Welcome to the Educated Parent Podcast. I'm your host, Dr. Leah Kleonsky, and I am so excited about the guest I have today because this is definitely going to solve a problem that we have all had. So imagine it. It's the morning, it's Wednesday, you wake up and your child has a fever. Do you take them to the doctor? Do you schedule an appointment immediately or do you try to wait it out and see how they do? To be honest with you, I have no idea, so I brought on our amazing guest. So I'm here right now with Dr. Ross Newman. He's a board certified pediatrician and the proud father of 6. So he has the parenting side of things with a lot of experience and sees a lot of kids as well. And his goal is to make kids' mental health simple, fun, and approachable for every parent. So blending medical expertise with real life parenting experience, he shares practical guidance on child development, illness prevention, and everyday chaos of raising kids. So he's on TikTok, on Instagram. We'll give you his handle at the end, but he's giving us amazing advice, and I am an avid follower. So thank you so much for coming on.
Of course, thank you.
We always have to talk evidence-based medicine, always the most important thing to approach.
Yeah, I mean, it's the only thing that kind of keeps us centered when there's a lot of flack flying all around us, right? That stake of evidence is what really gives us a basis of expertise and that we can be trusted.
Yeah, who knew all that research that's been going on for years?
Who knew 100 years of science would actually count for something down the road?
Well, I'm so glad that you're here. I'm curious, do you ever have a problem deciding whether to bring your kids to the doctor when they're sick? Like, has this ever been stressful for you?
Oh, yeah. I can remember one time when my second kiddo, my son, was vomiting on the floor and it was the middle of the night and he was rolled up in the fetal position. I was freaking out. I'm like, oh, does he have appendicitis? All these diagnoses are running through my head. And I'm like, man, do I need to take him to the ER? So on a whim, I pull up my phone to look at the call schedule and there's my name. And I'm on call. So if I take him to the ER, they're going to call me. So I was like, well, I better put on my big boy doctor pants and figure this crap out because otherwise, who else is going to do it? And so that was a big moment of clairvoyance for me because I was like, it's hard to keep it separated, your objectivity of your pediatrician brain versus how much you stinking love your kid and worry about them when they're actually going through it. So absolutely, it's difficult for me to keep that objectivity sometimes.
That is hilarious. I love that you would have been the person you were consulting with.
I mean, I probably could have called one of my partners, but I don't want to wake them up at 2 a.m.
No, that's really funny. I sometimes have this thought with my kids where I'm like, what would a child psychologist do right now? And I'm like,
wish I knew one.
I wish I knew. Luckily, actually, I do have a group chat I could bother, not at 2 a.m. probably. Yeah. But I'm like, no, channel, take a step back, try to think like the clinician you actually are.
Yeah.
What did you do? Did you bring him into the ER?
No, he was fine. By the next morning, he was fine. His vomiting went away. It was a stomach bug. He got his diarrhea the next day that we'd expect. But in that moment, he looked so pathetic and sad, and I was so worried that overrode all what I would have said if I was the pediatrician in the ER.
That's so. It's like your own emotional, the emotional intensity for you overrode all the clinical stuff.
Absolutely. And that's what I always tell, when parents have their kids having a first time febrile seizure, I'm always like, nobody's going to blame you. When you go to the ER, they might say, why'd you bring him in? It's just a febrile seizure. But I'm like, seizures are scary. If my kid starts seizing, I'm taking him to the ER. I don't know when that thing's going to stop. My objectivity goes out the window. So there's never any blame from a parent pediatrician for people losing their cool because it's tough when you love your kids so much to keep any type of objectivity.
Oh, absolutely. Especially you and I are like, oh no, we can't access our training. But if you don't have the training in the first place, I would be standing there too if my child were vomiting everywhere. We brought him to the ER on Christmas one year when he was 2 and vomiting because I didn't know if he would get dehydrated and I didn't know how to assess any of it. And I probably overreacted massively, but I didn't know what else to do.
With experience, you know what's really bad and what needs seen right away and what can wait till tomorrow.
When you're caring for yourself, are you someone who will wait longer to go to the doctor? Or are you more protective with your kids than yourself?
I've had a knee pain for about 6 years and I started PT 2 weeks ago. Luckily, I don't get sick that often thanks to my kids and my patients and maybe snacking off the clinic floor. So I don't get sick that often, but I feel like I very rarely will seek care for myself. I do a lot of home care for my kids and try to avoid antibiotics if we can and things like that. But I always bring one of my partners. And there have been times when I brought my kid and be like, hey, you know what? I think that I would say this, but I just want somebody else to tell me something that, is more objective.
Isn't that like the doctor stereotype to like not seek care for yourself, but
Yeah,
to
I mean, I'm not dying. Why do I need anything? Don't want to bother people.
I had to like actively have pneumonia the last time.
You have to be pretty sick to overcome that.
I think the hard thing with kids too, depending on their age or developmental expressive ability, is they can't describe for you how sick they are,
Yeah.
right? You're watching them and you're like my daughter will say to me, my throat hurts. My
Hmm.
throat hurts means I don't want to go to school today because I'm tired. Or it could mean I have strep throat. Or it
Hmm.
could mean I'm going to vomit. Or I yelled at my brother and now my voice hurts. Like it could mean lots of things. And now that she's a little older, I can like ask her more questions and try to figure out what was wrong with her. But like, especially
Hmm.
when they're super little, like they can't tell you at all what's going on.
And that's the trouble with pediatrics, right? Pediatrics and veterinary medicine have that in common where we have to really pull off our experience as parents and as learning what sick kids look like and what signs and symptoms, which are oftentimes very subtle, indicate your kid is sicker. And it's not always the number on the thermometer, right? There are kids that are 105 degrees and I send them home. And there are kids that are 99 degrees and I send them to the ER because they're sick, right? And
Mhm.
that's really what comes down to pediatrics is being able to recognize sick versus not sick. And a patient that can't tell you the difference between a retropharyngeal abscess that's about to block their airway or a little runny nose, right? That's causing a
Yeah.
little throat pain.
Yeah, it's like really, really hard to get that information and then to
Yeah.
get them to describe it. Now that you're saying this, I'm like having this thought. Is there a clinical name for that, like a glassy-eyed look kids get? You know what I
Yeah.
mean? Where you look at their face and you're just like, there's something wrong around your eyes.
Yeah, there's not a clinical name that I know. We call it, glassed over or ill appearing, right? We'll put that in our general exam. But there was one year with flu that me and my MA got so good at identifying the kids that come in with flu because they just look the sickest that we would have like an 80 to 90% accuracy. We're like, you have the flu. And we'd, do a rapid flu and we'd accurately guess it because flu is that classic example of those kids coming in looking like death, right? That glassed over, not all there look. But yeah, we don't really call it ill appearing.
Because sometimes I'll see it in my kids the night before they get sick,
Yeah.
right? Like I'll say to
Hmm.
my husband, I hope you brought your work computer home, right? Like I have a feeling one of us will end up at home with the
Yeah.
kids today because there's just, I don't know how to describe it, but
Dark
they have a,
circles around the eye. They're tired. Their muscle tone is just kind of droopy. Their cheeks are flushed. Like, yeah, that look.
that look where you're just like, oh no,
Yeah.
oh no, and will I get it next? I mean, another thing I think that drives parents into the doctor's office too is they're afraid that like every kid in their house is going to get sick, right? And then they're like, what do I do about ground zero patient?
I mean, that's the next question, right? If one kid has strep, do I need to treat everybody for strep? Do I need to test everybody for strep or, the virus, right? And that's the crazy part is viruses, especially, and strep too, will skip around, right? Some people will come off scotch free. They'll clear the virus, without getting any symptoms. Some people have mild, some people have severe. And that's the tricky part we don't really know about immune systems is why some people never get cold sores, even though everybody else in the family has them, or warts or molluscum or any of these things. And some people get them so intensely because we don't have the knowledge yet. It seems like magical or mystical, but I'm hoping that in 10, 20 years, we'll have a better understand the immune system and how those decisions are made and how that happens.
Yeah, that's so interesting. I'm thinking about this time where both my kids were sick with like a fever, and then my husband had hand, foot, and mouth. And we realized the kids, like he had the symptoms on his hands and feet. But like he had that, but the kids didn't have those symptoms. But then it was obviously clear that they must have had that as well. And
Yeah.
that's
Yeah. It's that variable penetration of disease, right? Where some people will get very severe symptoms and some people have nearly nothing or relatively disease free.
now that we're kind of laying the stage for this, help me figure it out. If my child wakes up with a fever, what are the three different things I need to be paying attention to, or the framework you would advise for deciding whether I have to frantically schedule an appointment for day of, or whether I can give it a couple days and see what happens?
Yeah, I think most of the information you need to know comes from the knowledge of what a typical illness course for a child is. So,
Okay.
the vast majority of illness in children, because of vaccines and medicine, is viral now, right? Most of these are going to start as viral upper respiratory infections or colds. If we think about the timeline of that, we can help understand the three things that we're going to talk about that are going to need to be seen. So most colds are going to get worse for about 3 to 5 days. That's where you're going to get your fever, your runny nose, your cough, your sore throat, headache, body aches, all these things. and they're going to escalate and get worse, and they're going to peak on that third to fifth day. After that fifth day, most people start to turn the corner. If it's flu or COVID or RSV, it might last up to 7 days. But then you start on this long recovery stretch, which is about 1 to 2 weeks. It takes about 1 to 2 weeks for all the inflammation, the runny nose, and the cough, especially nighttime and morning, to clear out. And that's your normal stretch, 3 to 5 days of fever, 1 week of getting worse, and then 1 to 2 weeks of slowly getting better. So when we think about what needs to be seen, we're looking for something that's not following that normal course. And we're really looking at 3 reasons that pediatricians need to intervene. And those 3 primary reasons are need for treatment of infection, like antibiotics or whatever, need for hydration, so they can't hydrate themselves via their mouth, or need for help with respiratory support, right? They are not able to keep breathing, because those are the 3 systems that are most likely to cause your child harm. So first, let's go with the fever. Like I said, most kids are going to have 3 to 5 days of fever. So in those first days, your first day of fever, oftentimes you're not going to know what it is. The fever will oftentimes appear before the other symptoms appear. You might not know if it's going to be a vomiting diarrhea illness, a runny nose and cough illness, a rash illness like hand, foot, and mouth. So coming in on that first day of fever, unless your child is meeting one of these other criteria, oftentimes is not going to be very rewarding. I know thousands of pediatricians, and they would all hold to this, will never fault you for coming in. We just don't get upset about, we don't think you're ever wasting our time, but we won't be able to help you very much. So if you're taking time off of work or pulling a kid from, they're resting, we're not going to give you much information. So the first day of fever oftentimes not helpful. But if your kid is going past 4 or 5 days of fever, or if you're coming up on a weekend and you're on day 3 or 4 of fever and you're like, oh, I do not want to go to an urgent care or an ER because I know they're probably going to overtreat me or not have the best expertise. Those are the 2 situations I say, because of the fever, bring your kid in. If it's going over 4 or 5 days, or if you're coming up against a weekend. There's not a number that I get worried about. And that's really controversial, but there's a lot of good evidence. There are kiddos that are 105 and are much healthier than the kiddo at 99. There's no good scientific evidence that your body will raise a temperature that's going to harm the brain on its own unless your child has brain damage or is in a hot car, like there's a hot external environment. So kids can safely get to 105, even 106, sometimes with flu, and not experience any negative side effects from that temperature. That's a big old myth. If it's 104, you're going to melt your brain, you need to go to the ER.
All right, so let me repeat what I understood as a parent listening and make sure I understood you correctly.
Yeah.
So what I'm hearing is that if my child has a fever, unless we are heading into the weekend, if it's day 1, 2, or 3, no matter how high it is, I'm good. I don't need to be scheduling an emergency treatment. So if it's Monday and it's first day and they just have a fever, I'm like, you're not going to be able to help me anyway. I'm not rushing you to the doctor today. We're going to just hang out.
Unless there's a severe other symptom that, and we're going to talk about like the breathing or they're not arousable or they're having other things. But if it's just a fever and they're breathing fine, they're drinking okay, they're sleepy but arousable, yep, that's true.
Yeah, you just let them watch unlimited Netflix while you try to
Bluey, whatever, K-pop Demon Hunter, whatever the fad is.
Perfect. Okay, that's actually very, very helpful. Good to know that. Unless it's a Thursday and I'm like, all right, let's just go in so that we can not be here on the weekend in case it happens to be strep or something like that.
Exactly.
Okay.
So that moves on to number 2, right? If you have a fever and you have one of these other severe manifestations of illness, then this is a reason to be seen too. So let's go to breathing, right? Since most of our illness is caused by upper respiratory infections, the breathing component becomes a very big one. Difficulty breathing is one of those things that you should be seeing immediately, day or night. Now, that's hard because that difficulty breathing is subjective. Some people see, well, I'm struggling to breathe through my nose because it's all clogged, so I'm breathing through my mouth. Is that difficulty breathing? So the big thing we look for is what's called retractions. Retractions are when you are adding in your chest muscles to help you breathe. So you oftentimes see them tugging underneath their belly, tugging in between their ribs, tugging above their collarbone, or breathing very fast. So most kids are going to breathe between 20 to 40 times per minute. But if they're having a hard time breathing, that might get 50, 60, or 70 times per minute. So the fast breathing or the labored breathing with retractions are signs your child is having difficulty breathing, and that need to be seen. Yeah, don't wait on that, day or night. There is some tricks, like if your baby's a little baby and they are trying really hard to breathe through their nose, sometimes if you clear out their nose with a nasal suction and some salt water, that will relieve the retractions. Sometimes just fever by itself can cause increased labored breathing. So in that case, sometimes you treat with a little ibuprofen or something, or Tylenol, and that can relieve the work of breathing too. Those are just kind of hacks. But when in doubt, if your child's having difficulty breathing, have them seen day or night.
Okay. Even fever or not fever, you're like...
Fever or not fever, right?
breathing, we're going in. Okay.
We don't mess around with oxygen to the brain. It's just a no joke.
Yeah, it seems like we shouldn't mess around with oxygen to the brain when you put it that way.
Yeah. And then the third one is hydration, right? When we're thinking about hydration, we're talking about blood to the brain, right? If you don't have enough water, your blood gets thick and you get dehydrated and organs start to shut down. You mentioned vomiting. It's really hard for a child with just vomiting alone to get dehydrated because they have a pretty good reserve. Children have a lot of fat. They have this special type of fat called white fat that stores water, and they can pull on that when need. So if they've just been vomiting for less than 24 hours, it's unlikely they're going to get dehydrated unless they're losing some water somewhere else, like diarrhea or something, or a burn. That being said, you're always going to be monitoring their urine output. That's the most accurate representation of how hydrated they are because their kidneys are going to be filtering. And if they're having less hydration, their kidneys are getting less blood. My goal is always for kiddos when they're sick to have at least 3 urine outputs per 24 hours. And this takes really close monitoring by the parents. That really is not a lot. If you think about it, if your kid pees at noon and then they pee once overnight and they pee at noon again, that's 24 hours. That's our minimum. Healthy kids are hopefully peeing 5 to 7 times in 24 hours. And that's your other focus, right? If your kiddo, for whatever reason, if you doubt they're making 3 pees in 24 hours, they need to be brought in for evaluation of dehydration because they may not be able to keep something down. They may need medication. They may need an IV hydration to get them feeling better.
As you're talking, I'm like thinking that time at Disney World when I did the Christmas Eve rush for vomiting was like a totally an overreaction. We could have been at Disney World and not in the ER.
Vomiting is dramatic though. Like it is painful. It's dramatic and makes your kid look like garbage. And when they do it 12 times overnight, you're not sure if you're having an exorcism or not, right? And so it's scary. Yeah.
Yeah, and they're miserable. And I think too, like in my mind was somewhere about like kids dying of dehydration due to vomiting. And so like it like just triggers like an anxiety response.
And it takes a little bit of time, right? They have to deplete their reserves. But when you're vomiting, remember, you're only just decreasing the input. You're not outputting more, right? The vomit's you're not pulling fluid from your system into the stomach to then vomit it out. You're just not getting anything in. The other thing to think about is lots of times parents will come in and be like, well, I gave him something, just vomited all back up. Well, the stomach is really good at absorbing water, especially when you're really dehydrated. So even if you give your child a small amount of liquid and it feels like they vomited all back up, if they're truly dehydrated, the stomach is going to start absorption right there. So you probably actually do absorb a little and then you do lose the rest of it. So what I suggest when kiddos are vomiting or they're concerned about dehydration, just give them really small sips, even like teaspoons or tablespoons of some liquid. Get it every 5 or 10 minutes instead of trying to get them to gulp down things because that'll irritate the stomach less and allow them to absorb small amounts of fluid to keep them hydrated better.
Yeah, that's helpful to think about. It reminds me, like, as an adult, when you're like, I didn't sleep at all last night. And then, like, your Fitbit or Apple Watch is like, you did sleep.
Yeah, it calls your bluff.
I perceived that I was awake. And it's like, no, like, biologically, you did.
Yeah, one thing I always do when I have, like, little babies and their parents are concerned they're spitting all their feeds up, I'll take a syringe. It's a 10 milliliter syringe, and I spray it on the table. It makes this huge old spot. I'm like, well, how big was your baby's vomit? Oh, so your baby's vomit was only like 5 milliliters, and their feed was actually 30 or 60. So your baby still got the majority of the feed, even though there was a large amount of spit up.
Oh, that's so interesting. This is really helpful. Like parents are going to listen to this and like I'm already feeling like I have a lot more knowledge base, frankly, about when to make and how to make these kinds of decisions. Every single parent is going to have sick kids. So this is really useful.
At least 7 to 12 times per year is the average.
Dr. Ross, thank you so much for coming on and sharing this information. Tell everyone how they can find you and follow you.
My tag is Dr. Rossome, Rossome, Dr._Rossome. I'm on TikTok, Instagram, YouTube, Facebook. My platform is all about education, taking away the paywall between good information for pediatrics and parents so they can just access it in the palm of their hand, and got playlists about sick kids, about vaccines, about misinformation, about, developmental milestones, all that stuff.
I find it to be so helpful personally, and I really appreciate you coming on and sharing this. And Dr. Rossome's tag is going to be in the show notes so you can find it and follow from there.